A headline greeted me this morning from the Connecticut Mirror that is very important. It's important to the individual, and it's important to Connecticut residents as a whole. It's about the possible expansion mandated by the state of mental health coverage on parity with physical health coverage. This might be a worthy thing, but it needs a very large debate and not executive signings of bureaucratic policy, because they are very costly in terms of our pocketbooks, and they could be very costly in terms of our mentality, our reliance on government once again. Now, the article features a nice woman in a horrible situation. It's Dita Bargava. I've met her. She's undergone maybe the worst human tragedy possible, losing a son to overdoses caused by fentanyl. The insurance policy that they were on didn't allow for extended treatment, or maybe did and they couldn't get it often enough because there were objections to their claims. Now look, that's the natural reaction of any insurance company, large or small, to very expensive treatments. And I'm making the argument that as much as we can to remove this from government legislation, because it's an argument that otherwise leads to mandated, full-blown mental health coverage that's very expensive. And the outcomes are very hard to measure compared to physical recoveries. You can measure heart rates and restored tissues. Very hard to measure mental health improvements or non-improvements. And this is an area that is most open to abuse by charlatans, people who will prescribe other treatments, people who might just prescribe other drugs. So the argument is for ourselves as communities and individuals, not the government, to be choosing insurance policies. There will be policies where you can choose to have mental health care covered. You could choose a high deductible or a low deductible. Insurance coverage should be amoral, meaning no subjectivity. You've bargained for these conditions to be covered. You've incurred these conditions. You're getting paid. Amoral insurance is a good thing because it becomes automatic and because then families can count on it. We can choose to be moral in legislation, but before we turn to legislation, we really should look to outside of government. That's especially because the government can't be as compassionate as kin. The government can't even be as compassionate as your neighbor, who might be able to counsel you better than a faraway healthcare professional. That's her job. And to some extent, she might have a little more expertise on specialty. But maybe the most expertise is right close to home, giving you a reason to live without drugs. So who should give treatment? At times, yeah, healthcare professionals. But make that perhaps a last resort, and before any problems happen, give everyone in the family a good reason to live without drugs. There's so much to live for. So coming from me, a stranger from you, to you, it makes so much sense to be resolute beforehand, that if you encounter pain, you're still not going to take that first opiate that might be prescribed to ease your pain. You put up with some, because the consequences of getting addicted from either a well-meaning or a not so well-meaning around you are horrible. Easing your pain is nice, but be resolute so you don't go down that path. In the wee hours last morning, I experienced pretty searing pain in a way that I'd never had before. Could it be the equivalent of childbirth. I will never experience that, but it was really, really acute. I did get myself to an emergency room, and I still said I'm not going to take opioids if they are offered. The most I'll take is ibuprofen, and that might reduce the pain if they give it to me. Um, Pain went down, fortunately, but if I were living with it, I have a game plan to not have artificial that could cause addiction. It makes sense for everybody, especially teenagers, to have that game plan. And part of that game plan is, what's the upside of not being chemically dependent on anything for your highs? Your highs can be looking at sunsets, walking around the lake. Your highs can be communicating with other family members, or if you don't like your family so much, other friends. Relish those instead of something that can get you physically feeling a little better or even a lot better, when mentally, a concert, all the music that's now free to download, can put you in a much happier state without chemicals.